Hi, friends. If you've been making your short notes with me, you're doing amazing so far. We finished part 1 and part 2 from BNF chapter 1. Now, in part 3, we'll break down diarrhea, exocrine pancreatic insufficiency, and food allergy. Nice and easy, step by step. Let's get started and make your notes super strong. All right, let's start with diarrhea. Grab your short notebook and write this with me. Diarrhea simply means passing loose or watery stools more often than usual. When it lasts less than 14 days, we call it acute diarrhea. Most of the time, it improves within just 2 to 4 days. Causes. It can happen due to an infection as a side effect of a drug, or sometimes as part of a chronic gut condition like Crohn's disease, IBS, or ulcerative colitis. It can also be due to lactase deficiency or changes in how the intestine works. Red flag symptoms you should always watch for: unexplained weight loss, rectal bleeding, persistent diarrhea that doesn't improve, recent hospital or antibiotic treatment, systemic illness, fever, severe weakness, or diarrhea after foreign travel outside of Western Europe, USA, Australia, New Zealand. If any of these are present, it needs urgent medical attention. Aims of treatment. The main goal is preventing dehydration. This is especially important in infants, frail adults, and the elderly because dehydration can quickly become life-threatening. Treatment. Most cases settle on their own. Oral Rehydration Therapy, ORT, is the first step. These are sachets with salts and glucose that restore fluid and electrolyte balance, such as disodium hydrogen citrate with glucose, potassium chloride and sodium chloride, potassium chloride with sodium chloride, potassium chloride with rice powder, sodium chloride and sodium citrate. If dehydration is severe and the patient cannot drink, hospital admission with IV fluids is necessary. For quick symptom relief, Loperamide is the most common medicine. But remember, it should not be used in bloody diarrhea, high fever, or severe abdominal pain. I'm not going to dive into all those tricky words right now, okay? But whenever you see a word you don't know, make sure to look it up and learn it. For example, what are opioid agonists? See, that's how we keep learning step by step. Let's do this without getting bored. Racecadotril can also be used as an add-on in children and adults with acute diarrhea. Antibiotics like ciprofloxacin are not used routinely, only in specific travel-related or confirmed infections. Other drugs sometimes used include codeine phosphate, cofenotrope, rifaximin, and bile acid binders like colsevelam or cholestyramine. Remember, you need to research every word here if you want to become an expert in the medical field. Okay, now let's move to exocrine pancreatic insufficiency. This condition happens when the pancreas doesn't release enough digestive enzymes into the small intestine. Without these enzymes, food isn't broken down properly. Main problems: maldigestion, poor breakdown of food, malnutrition, low levels of micronutrients, fat-soluble vitamins A, D, E, K, and lipoproteins. Symptoms: diarrhea, abdominal cramps, and steatorrhea, that's fatty, oily stools. Causes: chronic pancreatitis, cystic fibrosis, obstructive pancreatic tumors, celiac disease, Zollinger-Ellison syndrome, after GI or pancreatic surgery. Aim of treatment: simple, relieve symptoms and correct nutrition. Drug treatment: the mainstay is pancreatic enzyme replacement therapy with pancreatin. Pancreatin has lipase, amylase, and protease, which digest fats, carbs, and proteins into absorbable forms. Important tip: take pancreatin with meals and snacks. Dose should be the lowest effective dose, adjusted to control maldigestion. Caution in cystic fibrosis. Very high doses, 10,000 units kilogram stay lipase, can cause fibrosing colonopathy. Watch for new or worsening abdominal symptoms. Patient should be reviewed to exclude colonic damage. Other notes: acid suppression, like PPIs or H2 blockers, may help if pancreatin alone isn't enough. Always check fat-soluble vitamins, zinc, selenium, give supplements if needed. Non-drug advice: eat 3 meals, 2 to 3 snacks daily. Avoid legumes, high-fiber foods, and alcohol. Do not follow a very low-fat diet. Balanced diet is better. MCT oil isn't really helpful compared to a normal balanced diet. All right, last topic for today: food allergy. Food allergy is an immune response to food. It's different from food intolerance, which is not immune-related. Common allergens: cow's milk, hen's eggs, soy, wheat, peanuts, tree nuts, fish, shellfish. Also remember, cross-reactivity can happen. For example, someone allergic to cows may also react to milk from other mammals. Management: strict avoidance of the trigger food is the main treatment. Patients should get education on reading food labels carefully. ensuring proper nutrition while avoiding allergens, preventing accidental exposure in food prep. Drug treatment, sodium cromoglicate, may be used as an add-on in food allergy. Peanut protein immunotherapy can be given to children with peanut allergy and continued into adulthood. Antihistamines, like chlorphenamine, help with mild symptoms, flushing, urticaria, after accidental ingestion. Anaphylaxis, first-line treatment is intramuscular adrenaline/epinephrine. High-risk patients should carry a self-injectable epinephrine pen and know how to use it. Remember, we'll go into more detail about antihistamines in a future video. This is your short note for today, and you can always add anything extra you think is useful. In our next video, we'll start part 4 of BNF Chapter 1, where we'll dive into gastric acid disorders. So don't miss it. If you found this helpful, make sure to like, share, and subscribe so you never miss a new short note lesson. Thanks for learning with me, and see you in the next one.